Hello, my name is Elizabeth Hill, and I am the Graduate Degree Counselor for Messiah University's online graduate nursing programs. And today I'll be walking you through our information webinar session on Messiah University's online MSN and DMP programs. Before I start, I just want to say thank you for being here today. I know that the year of 2020 has not been easy for any of us. Needless to say, that has not been easy for the healthcare world. And so it's a great step for you today to be coming to learn more about furthering your education. And we are so excited to hear that you might want to consider doing that at Messiah. So welcome. First, just an overview of what we will be talking about today. So we will discuss the value of Messiah's online MSN and DMP degrees and why you should consider enrolling in one. Our program basics and structure, the application process for each program, tuition and fees, some frequently asked questions or FAQs that I get from students, and then time for you to ask your own questions of me. So first, the value of the MSN degree and/or DMP degree. So first, before I begin talking about the value of these programs, it's important to know who is the audience for these programs. And so you may be on this webinar thinking, oh, well, actually, I thought that I was looking at a nursing program, an RN program, maybe even a bachelor's program. So these are graduate level programs, and they do all of them except the postmaster's DMP, which does require a master's degree, require that you have a bachelor's of science in nursing. So if you don't have that and you don't have your RN license, you would need to consider at least going for an associate's degree in nursing. If you do have your RN license and you're considering maybe going for a bachelor's degree, we offer some adult degree programs that I'm happy to speak with you offline. But the programs we will be discussing today will be graduate level nursing programs. So the value of these programs really is impacted by how we're seeing enhanced job satisfaction, and though it's not mentioned on the slide, higher salaries for nurses who pursue higher education. And maybe even more importantly than that, we're seeing that nurses who go for higher education are showing improved patient outcomes and fewer medication errors in the healthcare settings that they're working in. And when we consider that a lot of nurses are now going for DMP degrees as those become more and more widespread across America, we're finding that those nurses who are DMP prepared nurses often have the critical thinking skills to question current nursing practices, as well as think about innovative ways to improve future nursing practices. So overall, going for higher education in nursing is a benefit all around. So to start, we'll discuss the MSN Nurse Educator Program. And so this program is ideal for the nurse that wants to go into teaching in nursing. Now, that doesn't mean that you would be, a tenure track professor necessarily. That would really be more so somebody that goes for a PhD or a DMP program. But you could certainly consider becoming a clinical nurse educator or an undergraduate nursing education teacher. It's just a way for you to give back to the nursing world as a teacher in it. And so this program is 100% online coursework. The clinical can be done at your place of employment. Usually. So what we ask students to do is to take the initiative in finding their clinical placement. And usually a lot of students like this because they do want to do their clinical where they work. If you run into any issues with that though, we do have somebody on staff who is there to help you find your clinical placement. And we have really had a very strong success rate in finding clinicals for our students. So don't be worried about that if that's something of concern to you. The total program is about 39 credit hours and 360 clinical hours. We have flexible start dates. Our next start date is January 10th, which is considered early spring. And then we also have a March start date, which is a little later spring. And we also have summer and fall start dates for 2021 too. And then in terms of the length of the program, it is about 3 years for completion for full time, though we do have a 2-year fast track. And then if you decide to do the program part-time, it would likely be a bit longer than 3 years, depending on how many courses you take a term. And so the MSN Nurse Administrator program follows a very similar structure to the MSN Nurse Educator program. But this program is really for individuals who want to go into administration in healthcare settings. So this might be somebody that wants to become a nurse administrator, a nurse manager. someone who really wants to kind of manage the floors, maybe have some supervisory role um, inside a healthcare setting. And so this program very similar. It's online coursework. The clinical works the same way, slightly different total credit hours and clinical hours, same start dates. Again, 3-year completion full time with an optional 2-year fast track. Part time will be a bit longer. And then there is the option to do a dual degree with our MBA program here at Messiah. Now, this is a very specific program and it's often not clinically nursing related. So if you do have questions about this program or it's something of interest to you, I'm happy to speak with you offline. There's just a lot of detail around it that would take a little while to explain. So I'd want to make sure you got all your questions answered. And then the DNP Family Nurse Practitioner Program. And so this program is ideal for somebody that wants to work in a family medicine health setting as one of the main providers of healthcare. And so what we're seeing is that a lot of family nurse practitioners are starting to become the primary care providers for people, whereas it used to be family medicine physicians. So if you're somebody that wants a little bit more autonomy as a nurse and you really like working with that family population, then this program might be the best fit for you. It is all online coursework. There is a twice, I think, during the program where you would need to come to campus to do some physical examinations that are difficult for the faculty to teach you virtually. Really, students do enjoy it. You come to campus out here in central Pennsylvania near Harrisburg for about a week or so for each time that you come, and you get to meet the faculty, you get to learn things hands-on, and it really enhances that virtual education. Again, clinical works the same way as the MSN programs. You're looking at about 86 total credit hours, and then a higher level of clinical hours just because it is a nurse practitioner program and it's a DNP program as opposed to an MSN. So we are looking for a little bit higher level of clinical exposure as a student. Same flexible start dates as the previous programs, and you're looking at a 3 to 4 year completion full-time and about 5 to 6 years part-time. And then for the postmaster's DNP in nursing leadership. So this program is really for the individual who wants to go into a pretty high up leadership role in nursing. So as I said previously, the DNP is giving nurses the critical thinking skills to think about the current practices that we're doing and thinking about ways to be innovative in the future. And so this degree is really something that is great for somebody that wants to think about health policy or nurse management. If you're really thinking about maybe trying to get into some research options as well, it's a good fit. So it's 100% online coursework. Clinical works the same way as the other programs. You're looking at about 34, to 39 total credit hours. That's going to be dependent on what you can transfer in from your master's degree. About 375 to 1,000 clinical hours for the program. Same flexible start dates, and then minimum completion of about 2 years for the program. And so now for the application process. So for the MSN Nurse Educator program, it's going to be very similar to the MSN Nurse Administrator program. So these programs are looking at official transcripts from all post-secondary institutions. That includes programs that were not nursing related. So if you started an MBA program and you didn't finish it, or you did a bachelor's degree in another discipline from 10 years ago, we still need those transcripts because we're trying to get an idea of your overall educational trajectory. An earned bachelor's degree in nursing from an accredited program, a minimum GPA of a 3.0 or higher, copy of your active RN license, personal statement, 3 letters of recommendation from those in the healthcare field, your resume, and a minimum of 1 year of recent professional nursing practice prior to the first nurse education course you'll be taking in the master's program. And so that is really designed for individuals who are applying from a previous BSN program that they just finished not that long ago. So the faculty want to make sure that you've really been exposed to nursing practice, clinical experience, before you would begin one of the higher level master's courses in the program. And then we're also looking for a grade of C or better in undergraduate statistics and research and health assessment courses. So the MSN Nurse Administrator application process is going to be very similar. Same thing with the transcripts, bachelor's degree, GPA, RN license, all of it. Again, we're looking for a minimum of 1 year of recent professional nursing practice prior to your first graduate level nurse administrator course in the MSN program. For the DMP program, it follows a similar application process to the master's program, with just a few things are a little higher, I would say, just because of the doctoral nature of the program. So, one of the things that's going to be different is that we need a minimum of 500 hours as a registered nurse in direct patient care within 1 year prior to admission. And the reason for that is that this is a nurse practitioner program and it is a doctoral level program. So they want to make sure that you've really had hands-on experience as an RN before you go through the program and graduate as a nurse practitioner. They want to make sure you're prepared for the coursework. And then they're looking for a grade of B or better in undergraduate statistics and research and health assessment courses, which is a slightly higher grade than for the master's programs. And then for the DMP nursing leadership postmasters DMP, again, similar, except, we're looking for a master's degree in nursing or a related field. So that is one thing. It doesn't have to be a master's degree in nursing. As long as you have a bachelor's of science in nursing, if you got your master's in public health or some business related masters, that's perfectly fine. They're looking to make sure that you can handle graduate coursework, so that, the DMP isn't quite a shock for you going into it. And then they are also looking for a grade of B or better in graduate level statistics, informatics, and nursing research. So again, this program is all about that higher level of leadership, looking at, moving into fields where nursing research and statistics are things that are really important to know in order to perform well in this program. So that's why they're looking for kind of a higher level of grades there. And then tuition and fees, you can see the breakdown right here. The DMP programs have a slightly higher per credit hour amount of $870. But the thing that's really great here that you can highlight is we do not have, or I should say, we have no fee tuition. And so what that means is that the tuition is transparent. You're not going to suddenly get, some sort of back end lab fee or book fee. Everything will be very transparent for you and open. So that's one of the great benefits of Messiah. And now just some FAQs. So what is the benefit of doing a DMP as opposed to an MSN to become a family nurse practitioner? So I think we touched on this perhaps earlier in the presentation, but the DMP, again, really has a wider breadth of material for you to learn to be prepared to come out as a nurse practitioner at the end of the program. What we're also finding is that, and that is from Messiah's faculty, they feel that the DMP prepared nurse is better prepared than the MSN one. At the same time, I think the DMP is also becoming the more standard graduate level degree in nursing. So I'm not going to pretend that I have all the statistics on this, but I could potentially see in the next few decades the trend going towards the DMP being the main degree that nurses want to get at the graduate level. So it'll only help you in your career as a nurse practitioner. Am I able to do these programs full-time or part-time, and how would this change my plan of study? So yes, it is possible to do the programs full-time or part-time. How it would change your plan of study really depends on when you start the program and which path you choose, full-time or part-time. So if you are accepted into the program, you will be assigned an advisor who will sit down with you, and they will be able to work through this plan of study with you to make sure that it meets your academic and your personal goals. But it might mean that you're not taking the same class that you would be taking if you started in the fall, if you start in the spring. And it might shift some things around, but ultimately you will be able to graduate in a timely manner. They will work with you on that. Am I able to apply for financial aid? So I'll just say up front that I do not work in financial aid and I am unfortunately not an expert at it, but I can tell you the advice that Messiah's wonderful financial aid office often gives students. One is, if you think you're going to need financial aid for the graduate programs at Messiah, to fill out your FAFSA as soon as possible. And then the other item of advice that they give is that you should definitely speak with your employer about any tuition reimbursement or tuition policies they have for higher education programs. I will tell you that Messiah does have some relationships with some employers where we are able to offer a tuition discount. If you want to speak offline about whether or not your employer is one of those that we work with, I'd be happy to do that. But I also encourage you to speak with your employer yourself, because a lot of times if it's not someone that we have a partnership with, it's really going to be the human resources department that's going to be the best person for you to speak with about getting that tuition reimbursement. If I struggle with a course, who can I speak with at Messiah? So again, like I said, you will be assigned an advisor, and that person can be your point of contact for pretty much anything that's going on with your coursework. They can provide you with resources on campus in regards to academic support or anything you might need there. But I also encourage you to reach out to your faculty. Messiah is a Christian-based curriculum school. And so the faculty are very compassionate people. They certainly understand what's going on this year, and they certainly understand what it's like to be a student that, is part-time or working and has a million things going on, especially as an adult. So they're happy to work with you if you have any concerns about the program. So now we'll just take some questions from you.